I want to talk about some controversial opinions that I have as an ICU nurse. And what makes me qualified to talk about this? I've been an ICU nurse for going on 8 years, and I've seen some stuff. First and foremost, we oversedate people. I think too many nurses sedate their patients out of convenience. And I'm really not faulting the nurses, I'm faulting the system because we haven't done enough education on the effects of too much sedation in patients and delirium and increased ICU length of stay, increased ventilator days, increase of all the bad things. The next thing is I think we either give way too much fluid or not enough fluid because I don't think we appropriately check whether to see a patient is adequately fluid resuscitated, and either providers jump to pressors too early or they give them way too much fluids and just don't even use pressors when they need to be using them. I don't think we consult the renal doctor soon enough sometimes when a patient's urine output's dropping and their creatinine's going up, and maybe they haven't dropped below the minimum amount of urine output, but they're definitely dropping. I don't think we intervene soon enough, and it ends up causing more harm to the patient's kidneys long term. I don't think we walk our patients enough. Now, listen, I get this because it's busy and there's not enough resources. And so I know sometimes you would love to like walk your patient all day long or get them up to a chair or whatever it may be, but you don't have the extra set of hands. And so it takes a while, it gets pushed back. Patients aren't getting as much therapy as they need. But in a perfect world, I would love if we could do some more mobility stuff with our patients and changing more of the culture to make it like the standard, the norm, even getting vented patients to chairs and things. Like I would love to do more of that, and I would love to see more of that like in general. And of course, we're going to make sure we do it safe because people are going to come to me and be like, "Well, if they're getting up to a chair, why are they still intubated?" Okay, there's a lot of reasons that you could be intubated and still get to a chair. The last one that I'm going to talk about is I think we let families control the narrative for way too long before we, kind of intervene. I think if we could talk about some of the hard things before we get to the hard things, it would make decisions a lot easier. I don't like how in the United States of America, people can override loved ones' advance directives, and providers are so scared about getting sued that they let them do it. Something's got to change with this one because it's really hard to see a patient that wants to be a DNR and not get intubated and become a full code and then like live in the ICU for months and go to a nursing home and be trached and pegged and just living out their life not the way that they wanted to end their life. Okay, I think that's it for now. Let me know if you have any other controversial ICU nurse opinions or just opinions in general on things.